Okay, welcome back dear friends. I am Dr. Klim Raza. Today in this lecture we are going to discuss the basic and the clinical anatomy of respiratory system. This video lecture is going to help you to understand the structure of the upper respiratory tract and lower respiratory tract. We are going to review the structure of the esophagus, then we will discuss about the trachea, and most important, we are going to discuss this very important, the beautiful infrastructure inside your lungs, the bronchopulmonary segment, total 20 in number. So stay with us please. We are going to make this lecture very helpful and easily understandable. When we are talking about the respiratory system, we have to divide respiratory tract into two pathways. First is the upper respiratory tract, second is the lower respiratory tract. You may have heard the pharyngitis, or you have heard about the a low respiratory tract like infections like pneumonia, and upper respiratory tract like common cold, or this pharyngitis which is very common in winter season. You have heard about the tuberculosis. You have heard about the lungs cancer, which is a leading cause of death in males. You have heard about interstitial lung diseases and asthma. So all these diseases are related to the respiratory system. That's why, dear students, dear friends and doctors, to understand the anatomy of the respiratory system, this is very important. And then that how lungs are basically communicating with the heart. Bluntly speaking, the respiratory system, this is directly collaborating with your cardiovascular system. So remember, right side of the heart or the left side of the heart, especially the right ventricle or the left atrium. This is part of your lungs. If right ventricle is intact, pulmonary artery is pushing the blood into the lungs. Left atrium receiving the blood through pulmonary veins. So remember, this respiratory system is directly connected with your cardiovascular system. So please, pharynx, in this picture you can see the pharynx. We have to divide the pharynx into three parts. Here, this upper part is the nasopharynx, this is the oropharynx, and this is the hypopharynx. The bony landmarks of the pharynx, basically it starts at the lower part of occipital bone and it extends up to C6. These landmarks are very important. So pharynx will extend up to C6, and then from C6 trachea will start. And now trachea, this is part of your respiratory tract, please remember. And then you have got the voice box also with the pharynx, the larynx. Here you can see, this is your hide bone, the hide one, and then this is the voice box, the larynx. Yes, laryngeal nerve working nicely. Okay, the larynx. So the larynx landmarks C3, C6. So larynx is going to start from C3 and it will extend up to C6. But when you are talking about the trachea and its relations, this is very important. This structure. Yes, this one. So here you have got trachea, this windpipe, you have got thyroid cricoid cartilage here. And remember, the trachea is going to start from C6 and it will extend in front of intervertebral disc of T4 and T5. And this is a junction of the superior and inferior mediastinum also. And this is a joint of the manubrium of the sternum with the body of sternum, and that is called as sternal angle. We have discussed also. So remember, the trachea, this is made up of these special tracheal rings. Structure above the trachea, here you have got cricoid cartilage, and then you have got thyroid cartilage also. And posterior to trachea, you have got esophagus. and you have got anteriorly the sternum also. Anterior and inferior you have got the right and left bronchus also, and here you have curve of the arch of the aorta. So any compression, any disease relating to this, are roots of the blood vessels or the posterior auricle, the left atrium, will lead to compression of this structure, and then secondary compression will be the esophagus. So if you will compress the trachea, you will have difficulty in breathing. So dyspnea with dysphagia, it may be because of the left atrial enlargement. So you have to remember the relation of the left atrium, arch of aorta, with the trachea, with the bronchi, and with the esophagus as well. So these bony landmarks. And then in case of the choking or the aspiration, we have added in this lecture, I have shared with my students that how you are going to perform the Heimlich maneuver. And then the tracheostomy, which is also very emergency procedure. The tracheostomy incision, and frequently asked question, the tracheostomy incision, you will give this incision between second and third tracheal rings. So tracheostomy incision, this is also very important question, that among which tracheal rings you are going to give the tracheostomy incision between second and third tracheal rings. And then remember that these anatomical difference of the right and left main and primary bronchus, this is also important. Here you can see this right bronchus is vertical and broader, wider and shorter, but this one is narrow and more horizontal. Any foreign particle, suppose someone have inhaled the peanut, so this peanut probably move to the right side of the lung, because right bronchus is more vertical and wider. So any foreign particle inhalation or the peanut inhalation will move to the right lung, and right lung having, remember, right lung having 3 lobes, because it's having 2 fissures. One is the oblique fissure, other is the horizontal fissure. That's why right lung having 3 lobes. Left lung having only 1 fissure and it's having only 2 lobes. So any foreign particle inhalation will enter to the right lung because of this wider right bronchus. And if patient is standing, that foreign particle will be in lowermost bronchus, in lower portion of the bronchus because of the gravity. But if patient is lying on the spine, bronchus will remain same, the lobe will remain same, but that will be the upper portion of the lowermost segment. Remember this also. This is also frequently asked question. And then next, when we are talking about the structural, functional and surgical unit of the lung, and that is the most important. This is what I have just shown you. This is your bronchial tree, the bronchopulmonary segment, the segmental bronchi. You have got 2 lungs, the 5 lobes, and nature have given you 20 bronchopulmonary segments, and these bronchopulmonary segments are independent in function because they have got segmental vessels, but just segmental artery, not segmental vein. Later I will tell you. They have got segmental nerves also, the autonomic nerve. They have got the lymph vessels. They are basically 20 in number. And why I am calling that these bronchopulmonary segment are the structural, functional and surgical unit of the lung. So in case if you have got any pathologies, like you have got tuberculosis or the carcinoma of the lung, so if just one segment is damaged, you can remove surgically and other part of the lung will remain intact, and you may continue your breathing, gaseous exchange mechanism. And you have to understand about the surfactant also. That surfactant, which is also produced by type 2 pneumocytes. Later maybe I will forget, this is important information. That surfactant is produced by type 2 pneumocytes, and during the embryonic life after 27th week of gestation. So its production is fully mature by 32nd week of the embryonic life. So anyone preterm baby, premature baby before 32nd week of the gestation, will die because of the deficiency of the surfactant, because of the ARDS, acute respiratory distress syndrome. And to mature your lungs, to mature the surfactant, you will give the betamethasone injection after 27th week. Remember please also. So this is also important information. And then I have just told you that you have got 20 bronchopulmonary segments and you have got 5 lobes. So in right lung I have told you have got 3 lobes because of the 2 fissures. You have got upper, middle and lower lobe. But how many bronchopulmonary segments? How many bronchopulmonary segments you can see here? Look. How many bronchopulmonary segment in right upper lobe? 1, 2, 3. So how to memorize names of these special bronchopulmonary segments? Okay, I will make it easier. So first is the apical, because it's on the apex here, apical. Then you have got the posterior, and then you have got anterior. So this is right upper lobe, 3 bronchopulmonary segments there, apical, posterior, anterior. And then in middle lobe, you have got 2. In middle lobe you have got 2, lateral and medial. How to memorize? Look, write please, a palm, small p, a palm, small p. Okay, first one is the apical, second is the posterior, third is the anterior, fourth is the lateral, fifth is the medial. So far you have completed 2 lobes of the right lung, apical, posterior, anterior, lateral and medial. Now how many bronchopulmonary segments left? In right lung 5 more. So here 5. So right lower lobe you have got 5 more. So a palm, then small p. So these five, apical, posterior, anterior, apical, posterior, anterior, right upper lobe, lateral medial, right middle lobe, and then these all are present in right lower lobe. S is the superior and M is the medial basal, A is the anterior with the sequence, A is the anterior basal, L is the lateral basal and P is the posterior. Why basal? Like here you have apex, so this will be apical. Here is the base of the lung, so this will be basal. So in this way you have to remember and you will not forget. And in left lung you have got 2 lobes, but still you have got there 10 bronchopulmonary segments. So it's easy to remember. First 3 will remain same, apical, posterior, anterior. And here, because in left lung you have got special structure that is called as lingula. So 4th is the lingula superior, 5th is the lingula inferior. Just memorize these two. And in left lower lobe, same bronchopulmonary segment as in right lower lobe. First is the superior, then you have got medial basal, anterior basal, lateral basal, and then you have got posterior basal. So these 20 bronchopulmonary segments are basically the structural and functional and surgical unit of the lung. And each bronchopulmonary segment is pyramidal shape. And it's basically towards the hilum of the lung. So each bronchopulmonary segment is basically having its own segmental artery, you may write segmental artery, and then segmental bronchus, and then segmental autonomic nerves, and then lymph vessels are the lymph nodes. So that's why this bronchopulmonary segment is independent in function, but except the segmental vein. Why segmental vein is not present inside the bronchopulmonary segment? There is a reason. And what is the reason? Okay, so suppose this is one bronchopulmonary segment and this is the second bronchopulmonary segment, pyramidal shape, and in between this bronchopulmonary segment you have got the connective tissue. And this is another your bronchopulmonary segment, and this is a connective tissue there. So between these bronchopulmonary segments, here is your segmental vein. So this is very important to understand the significance of this segmental vein. Why this is important? As I have told you that this is a surgical unit. Whenever you have got cancer of the lungs, or you have got tuberculosis, which is very common infection in our countries. So if this segment is now damaged, suppose you have got tumors, or you have got infection of this bronchopulmonary segment, and you have to remove this bronchopulmonary segment. How surgeons will approach and will find the borders of this bronchopulmonary segment? They will find the borders through this segmental vein, through this segmental vein. So they will reach and they will find the margins and borders of this bronchopulmonary segment, and they can remove easily. So remember this clinical significance also, that 20 bronchopulmonary segment, and each segment with the segmental artery, with the segmental bronchus, with the lymph nodes, and then with autonomic nerves as well. And in next structure you can see this is basically the hilum, the root of the lung. Because root, why this is called as root of the lung? Because your bronchi entering to the lungs through this hilum. Pulmonary artery will enter to the lungs carrying deoxygenated blood, the only artery, remember, and through the hilum. Pulmonary veins exit the lungs through the hilum carrying oxygenated blood into the left part of your heart, left atrium. So all these structures, whether these are arteries, veins, or the bronchus, they are forming the root and entering the lungs. So this is called as hilum, or the root of the lung. So you have to prepare and draw this structure also, please. Next, so this is about the pleural effusion. That what is the pleural effusion? Basically you have got two types of the pleuras. The inner covering above the lungs, you have got a visceral pleura. The outer covering behind the thoracic wall, you have got the parietal pleura, which is sensitive to the pain and temperature. So space between these two pleuras is called as pleural cavity, which basically occupying your pleural fluid. But in case of the severe chest infection like tuberculosis, like pneumonia, or in case of the heart failure, or in case of the liver failure, or in case of the renal failure, there will be accumulation of the fluid inside your body cavities. So this pleural cavity accumulation of the fluid, this is called as pleural effusion. So you have to aspirate, you have to take the sample of this fluid for investigation purposes. And what are the anatomical landmarks? This is important, and this procedure is called as thoracocentesis. Thoracocentesis are the pleural tap. So remember, each intercostal space we have got total 11 intercostal spaces, 12 pairs of the ribs. Each intercostal space having its intercostal vessels also. So you have to understand that you must keep the needle. Look, this is suppose posterior your 7th or 6th or 8th intercostal space, and you are inserting the needle and you are keeping to the upper border of the rib and lower border of the space. Why? If you will keep to the upper border of the space and lower border of the rib, you may damage the intercostal vessels. So always keep the needle to the upper border of the rib and upper border of the rib. This is automatically lower border of the space to protect your vessels. So I hope this review lecture, this review rapid revision of the respiratory system was helpful. In addition, you have to prepare the mediastinum also. The contents of the mediastinum, the boundaries we have already discussed. So till next lecture, take care. Thank you.